Morning guys, hope you well. Just dropped off Arora to school. I thought I'd do a super quick video on a super simple tip for dealing with a situation in a role play or a consultation where someone comes in very anxious or comes in very embarrassed. You know the scenario that you've practiced when you kind of see the past medical history, you kind of have all these questions in your mind, you want to get the role play going, and someone comes in and they just don't open up for various reasons. They're very quiet, they're very anxious, and you start getting a little bit stressed because you're looking at the time, you're thinking, gosh, why is this not rolling? I want to ask so many questions, time's running out. But the other person quite naturally is feeling anxious, embarrassed, doesn't really want to talk about the things that you want to talk about, and it can get quite stressful. So one of the simplest things that you do, and we've talked many times in the past about creating an environment of safety and making sure that someone feels listened to and that they have time. But one of the simplest things that you can do in this kind of situation is thank the person for coming. There's something so powerful about thanking somebody for coming when they're feeling anxious or embarrassed, to show that you're not there to get a job done. You're there to actually help them. You're there to offer them the support that they need. So for example, Mrs. X comes in very embarrassed. You can see from body language that she's not really keen to talk. Thank her for coming. Mrs. X, I can see this is very difficult for you. I can see that it's really tough for you to have come in today to talk about this, but I just want to thank you for coming, because for you coming today, it means that we can somehow maybe offer you some support, and I want to thank you because I know how difficult it can be to come in to talk to somebody, a stranger, about something that's clearly difficult to talk about. So thank you so much for doing that. Take your time. I'm here to help. I'm here to listen. Sometimes that little act of thanking someone for coming in to have a conversation, to have a consultation, to have a discussion can break so many barriers down, because it shows that you're not just there, like I said, to get your questions out, to do your job, to tick through your time. You're there to support somebody in their time of need. So if you get a role play and you're practicing or you're doing assessment and you get someone who's anxious and embarrassed, then remember, create that environment of safety. And we've done videos on how to do that in the past. But one of the key things to think about doing is thank them for coming in. It's amazing how much difference that can make. I really hope this helps. Loads more communication skills videos on our YouTube channel. Please do subscribe, share, like, comment, tag, like you guys so kindly do on a regular basis. If you want 10% off any of our communication skills courses for things like PLAB 2, RCA, CSA, com skills type exams, then have a look at the website aroramedicaleducation.co.uk and use the coupon Arora Video 10, ARORAVIDEO10, so we can help you with these kind of things for your role play and consultation based assessments. Have a great day. You know the hashtag, Can Pass Will Pass, hashtag I went with Arora. Take care.